Hi everybody, my name is Michael. I fully understand where you are, as I've been in prison myself on 3 separate occasions. The last time I was in prison, I was sentenced to 12.5 years with my father. We were arrested for drug importation. We shared the same cell for the first few years. I understand the fear, the loneliness, also the high and the joy that prison life can bring. I used my time in prison to change. I'm 21 years sober and a recovering alcoholic. The pandemic is dangerous, so I'm going to explain to you about what is expected of you to keep safe and well. COVID-19 is hard for everybody. It's even harder being in prison, away from your friends and family, worrying about how they're coping, not getting to see them. And there's worrying about your own health as well, as getting your head around all the changes being made to help keep you safe and stop the virus from spreading. This is a 2-part story told in pictures about 2 friends, Jed and Kate. The second part of the story explains day-to-day life for Kate in a psychiatric hospital during the pandemic. It also explains different things that may happen if you get sick in a psychiatric hospital. It may help you to think and to talk about how you're feeling too. Pictures can be very powerful. This book isn't a soft option. There are some really hard things it covers, like what could happen if you get ill, the boredom and frustration of being isolated, and facing up to death and dying from COVID-19. Kate's story. This is Kate. She is thinking about her friend Jed, who is in prison. Kate is really upset, and her foster dad calls the doctor. They are both worried about her. She is taken to hospital where a nurse is expecting her. The nurse explains things to Kate. Kate must wash her hands often. Some people have swabs for coronavirus taken from their nose and throat. Kate has a room on her own. She is feeling really scared. The nurse comes to see her and brings her things to do. Kate really isn't feeling well. Has she got coronavirus? She takes some paracetamol. Kate has gone back to bed because she's feeling poorly. The nurse takes her temperature. Kate has got a fever. Kate is taken to another hospital because she's very ill. The doctor explains about the treatments Kate can have. Kate's dad is allowed to visit because Kate is very ill now. Sadly, Kate dies from the virus. The nurse rings Kate's dad. Jed hears the news from Kate's dad that she has died. The chaplain invites him to come and talk about Kate. The chaplain writes a note to Kate's dad saying how sad he is. Jed goes to see the chaplain again to talk about how he feels now Kate has died. Jed tells him that he should have said yes to the vaccine, and he wishes Kate had had the vaccine too. You can ask for a printed copy of this story if you want to read it again. Take a closer look. Think more about things you don't understand. Think about how you're feeling and the thoughts that come into your head. And if you have a question or worries about your health or your risk of coronavirus after watching this, don't bottle it up. Talk to someone. Ask to speak to one of the healthcare team. If you're feeling stressed or anxious or even wondering how you will carry on coping, and it's quite normal to be feeling like that, tell someone. Talk to your roommate if you have one and get on okay with them. If you don't want to do that, there are key workers, wing officers, the chaplaincy team, listeners, nurses and doctors. They're all there to help you. They're all in this with you. It's tough, but together we'll get through this. Thank you for listening.